We are live. We're live now. Welcome back to our next Tuesday topic. Today we're going to talk about BPPV, basically a fancy term for vertigo or that dizziness. Benign paroxysmal positional vertigo. That's a mouthful. Basically means you get this sudden vertigo, this feeling of dizziness based on head position changes. So if you get up from laying down, if you're sitting down and you stand up, something like that, some sudden change in head position, then you get that vertigo feeling of dizziness, like the room spinning. Can be some nausea involved, migraine, stuff like that. Basically, what it comes down to is this structure in our inner ear, way deep inside these semicircular canals. So if something happens, if you bump your head, or even if it just comes out of nowhere, these crystals, which they're normal, they're in all of our inner ears, they kind of get dislodged and they can be kind of floating in the fluid in these semicircular canals. And normally they're not there, so they're kind of floating, moving along in the fluid, and your body then thinks you're moving because these canals sense head movement, body movement, stuff like that. So now you got this structure kind of moving through there, and you think you're moving. In reality, you're standing still, but your brain and your head thinks that it's moving. So what we can do as chiropractors and here in the office, we can diagnose this. Very easy, specific test that tells us if it is BPPV or if it's something else. And two, we can actually treat this pretty well. It involves a very specific set of motions of the head, basically to reorganize these crystals and to kind of get them back to where they came from, and to calm down that motion inside these semicircular canals. So then that vertigo gets better, those migraines, dizziness, stuff like that calms down because your body doesn't think it's moving anymore. So if you're experiencing some of this stuff, some dizziness that you get when you get up quickly, some stuff like that won't resolve, give us a call. I bet we can give you some answers, or at least kind of point you in the right direction. So thanks for watching. Hope you learned a little something about the inner ear. We'll catch you guys next week.